My goal for patients when they come in this office is to see that as practitioners, we're people too, and we genuinely want you to feel better. And we're going to work really hard with all the different modalities of care to help you find your best self. And the way we do that is with collaborative care. For instance, let's talk about an adult coming to the office who might be struggling with sleep disordered breathing and couldn't tolerate a CPAP. We'll take, all of the wonderful imaging we do. We take a 3D image and look at that whole head and neck and see what might be going on in there. We also send it off to a radiologist to be read. So if there is something outside our scope that could be seen on the x-ray, let's say you have nasal polyps and that was the problem. Well, we're going to get a report back. And the next time you come to see me, I'm going to review that report with you and say, hey, look, we've got this nasal obstruction. We need to go see an ENT. And there's the point of collaboration where I get to collaborate with that ENT, show them my image, and they get to work with us together to make you feel better. Now, let's say an oral appliance is appropriate for you. We looked at that 3D image and we saw that there were some kinks in that hose of how you breathe. Well, would an oral appliance help open up some of that kinks in the hose? If so, we'll get you going in that appliance with approval from your sleep doctor. And, let's say you don't have a sleep doctor. Well, we have one that we can call in to help you to do that sleep study. And then once we make that sleep appliance, we need to make sure it works. So I have to collaborate with either sleep doctor you came in with, or maybe it's Dr. Battle who came by to see you, so that you can have great access to care and not be waiting 6 months or something like that to get into a clinic and get care right away. And then we'll look at those post-sleep studies that you'll get to take home a study, sleep with your appliance in your real environment, the way you normally do your day-to-day activities, and see if the appliance is working for you. Then you get to circle back with the sleep doctor and say, is my sleep optimal? Was the sleep appliance that Dr. Sabet or Dr. Kim made for me working? And if there's extra things we need to do, guess what? We have the information and we can maybe augment with some night lays, or maybe it is that there's some insomnia that Dr. Battle can help you with. That's real collaborative care, where the physician that we're working with understands what we're doing here and we understand what the physician is doing so that we can all work together so you can be your best self.